Nothing like starting a session like this with the most exciting talk. But
Happy birthday, Dr. Tass.
Dan, you promise.
Facebook.
Okay. So, unfortunately, I don't have any disclosures for this. I would love to. It's a big area. But vascular imaging is a very significant emerging technology in the field of vascular surgery, and has really revolutionized a lot of the things that we've been doing in recent years. But when you start looking at it from a presentation perspective, there's so many things in there to talk about. So I thought I'll give like a little bit of an outline in the beginning of what I'm going to be talking about, and then I'm happy to expand in some of these areas. Full disclosure, my experience with computer imaging is very limited. So a lot of us worked for many years with C-arms. C-arms have totally changed in recent years, so I'll give you some of the new capabilities of that. Some advanced CT and MR fusion capabilities of the fixed imaging systems, and also the integration of this fusion technology, if you will, with new catheter-based navigation systems. Some catheter robotics, and also some artificial intelligence applications on vascular imaging, and how we are trying to utilize those in terms of improving, number one, our diagnosis, sometimes developing predictive models, and also facilitating our treatments. So starting with the C-arms, I'm not going to spend too much time here. One of the biggest advances that have happened in recent years is the development of flat panel detectors, and those are rapidly displacing the traditional image intensifier systems. The benefits of having those flat panel detectors is increased sensitivity, lower noise levels, but also a lower radiation dose, which is important for all of us. Some of the other advances is the more active cooling systems. For those of us that grew in the area of the 9800, we know that after a certain time, like you had to stop because the system, was so much heated up, that you knew that you would take it out of commission for quite some time. But the newer systems are clearly providing better cooling applications. So I'll move to the cone beam CT. The applications for that are mostly in aortic engrafting, but also in needle-guided treatment and transarterial embolization. This is for the people that are using a Siemens system, the Dyna CT. Those are using Philips, the Expert CT, and those that are using GE, the Inova CT. There's an example of all of these. This is a renal artery aneurysm. This is from a publication, and the idea is that you can clearly identify the branches coming off of that aneurysm, and then your coil embolization becomes a much more accurate procedure. I'm going to show you one of my cases. This is a patient that was quite old, had an old endograft, a type 1A endoleak. We used this fusion technique essentially to identify the zone where a seal could be achieved, and you can see here that we're actively deploying an endoanchor right at the area of interest, and then moving on, you can see how we're correcting the image to go completely perpendicular, and deploy the next anchor, in the appropriate position. So there's a number of benefits for image fusion. You reduce the amount of contrast needed. There is an accuracy in mask alignment, and definitely decreases the operative time. There's a number of limitations. A lot of it has to do, with patient movement, and adjustments that need to happen. And sometimes, if you're using a CT prior to a device being deployed, then you're having that device deformation that clearly interferes, with the accuracy of this. Some of the things that have come out recently with the fusion technology is this fiber optic real shape technology. These are all navigation systems that use electromagnetic technology. There is one that is specific to the Philips system. You can see this right here. They have even wires and catheters that are specific to that system. So those wires are being recognized and you're navigating them inside the aorta and into the branches without utilizing any X-ray. Clearly decreases the amount of radiation exposure for the surgeon, and also is particularly successful in the newer versions in cannulating the branch vessels. It decreases the catheterization time in complex aortic interventions. There are still limitations. There are very limited tools that are available for that. A couple of wires and a couple of catheters. Once the range of catheters improves, I think that this will be incorporated in our practice. This is a device that is made by Centerline Medical. It's compatible with the Zigo and the Pheno systems, and it's a similar principle where you're using those catheters and wires that are being imaged essentially on this screen. You have a field generator and an interface unit that allow all of these things to happen without using radiation. I don't know why my slides will not advance. Thank you. A couple of things about the robotic systems. They've been coming out, in general surgery, robotic surgery is right now, the very preferred method. I think in vascular surgery, this is still a technology that is looking for an application. Not necessarily well-defined applications yet, but it seems like that there are at least 4 different systems. This one, the core path by Corindus Systems, has gotten FDA approval. There's catheters that have been developed for that. The biggest advantage of utilizing a system like that is that the operator can be remote from the patient, so you can save yourself from exposure to radiation, particularly in long cases. It has been tested in difficult catheterizations. There are steerable catheters that work particularly well, with these devices. However, the cost of it is prohibitive right now, and clearly the setup is such that interferes sometimes with our imaging capabilities. I think that as this is refined, it probably will have certain applicability. One of the things with this Corindus system is that they have worked with specialists around the world for remote interventions, essentially having a specialist far away that can operate the console and have an operator on the field that could potentially allow for experts to be able to offer their skills with the help of a local system from a remote location. We're far away from that, but I do know that with the Corindus system, there was a case of heart catheterization and a coronary intervention that happened from 35 miles away. There are 4 other systems in this category. They're still looking for FDA approval. The Magellan, the Monarch, the Ion, and the Super Dimension navigation systems. All of them will essentially aim to bring automation to endovascular navigation, and it remains to be seen how we're going to be using those. And then a couple of words on artificial intelligence in computer imaging applications. There is a number of efforts on that direction, particularly with advances in computer imaging, accurate segmentation of the aorta, accurate analysis of aortic wall characteristics. This is not as well developed as the segmentation of the entire aorta. Developing predictive models of aneurysm disease and progression. incorporating flow dynamics into simulated analysis and trying to predict how certain devices will behave in a certain anatomic environment, and then use that for procedure planning and for device fitting so that you're picking for the certain patient the best endograft or the best appropriate approach. This is from work that we're doing at Stony Brook. This is our computer imaging people that have worked in perfecting an automated aortic segmentation system compared to what we currently have. This has allowed us to capture not just the aorta, but also the aortic branches up to a certain extent that we have predefined. These are some characteristic pictures of that. These are based on regular CT angiograms. And then we are currently developing a mesh that will allow us to isolate the aortic wall so that we can study aortic wall characteristics and separate the aortic wall characteristics from the entire volume of the aorta. We're working on computer vision applications for accurate measurements of aortic size, of aortic diameter, and also of aortic volume. Aortic volume is becoming something that we're more and more closely looking in terms of predicting success of our endovascular interventions in aortic aneurysms. This is from a couple of work presentations that we presented this year. This is an accurate measurement of the ascending aortic diameter, where our system essentially takes away the noise that is created from the heart cycle, and we can predictably measure the diameter at the very same spot. And then this is work that was presented in the Eastern Vascular Society. One of our medical students has actually developed this model where he superimposes the images of the aorta pre and post intervention and predicts two things. Number one, behavior of the aneurysm in terms of aneurysmal regression, and number two, prediction of type 1A endoleak. This is very preliminary work, but we've done it initially in a simulated environment and then using some of our cases, and on a 12 patient population, he was able to accurately predict the 6 patients that developed type 1A endoleak over those that didn't. A lot of work to be done on that, but certainly an exciting thing. And with that, I want to thank you for the opportunity. Jim, thank you for the invitation as always.